Hi everyone, welcome to another webisode of The Good Doctor. Today I'm in the company of Dr. Mahesh Vidhani. He's a specialist orthopedic surgeon from Sharjah Corniche Hospital. Welcome to the program, doctor.
Thank you, Mr. Shah, for having me today.
So the first conversation that we're going to have is injuries, sports injuries. How common are they?
As you know, more and more people are getting health conscious and more people are playing sports. So these injuries are getting more and more commonly. We are seeing these injuries. And it's very important to understand those injuries, how it occurs and how to prevent it.
We're kids at heart. Everyone likes to do sports these days.
That's right.
What are we susceptible to when we talk about a sports-related injury?
Yeah.
What are we susceptible? What is the body susceptible to?
There are two kinds of injuries we come across. One is acute traumatic injuries, which we see in contact sports like football or rugby or boxing. And another kind, which is more common, is repetitive stress injuries or due to repetitive trauma injuries. And these both are preventable, and if we take care, and and treatable. So we always encourage sports, and we keep encouraging, and we prevent and treat these injuries.
So how do we prevent them?
When we are going to start the sport, we should be mentally and physically prepared. Mentally, like we should understand which sport you're going to play, and you should understand your activity level, whether you are fit to play that sport.
Right.
For the physically, you have to train yourself. When you are starting any sport, you should get warmed up well. You should have perfect training program before, so that you are fit to play that sport. This is very important in dynamic sports like football or basketball or tennis.
That's a great point. Know the limits of your body, and you've got to make sure that you don't overstress your body when you're working out. Make sure that if you are going to get involved with contact sports, as you said, or even if you're going to the gym and doing an aerobic exercise or one of these classes, you got to make sure that your body's completely warmed up. Now, when we're talking about, let's give the audience a real life example. What can you talk about?
Traumatic injuries, we come across acute traumatic like any sprain or strain of the muscle, or it may be a wound, or sometimes if more serious it may be a fracture, it may be a dislocation. If more serious it may be neural involvement.
Right.
It depends on activity level and sports level and sports
So
particular
if we
involved.
tear a ligament or injure a knee or dislocate a shoulder, those things would be traumatic.
That will be traumatic injuries, that's
Okay.
right.
And what are the softer injuries that we can experience?
Now we come across more like repetitive stress injuries more commonly, which are again like tennis elbow, tendonitis, runner's knee. These are very commonly we are coming across, and we are treating those.
Would a shin splint be considered as a...
Definitely. Again, shin splint would be considered as a repetitive stress injury.
If we get these kind of injuries, what kind of immediate actions can we take before we reach the hospital or reach the doctor?
When we see an acute injury, we want general population to follow this RICE regime.
RICE.
RICE, where RICE is. R stands for resting the part.
Right.
We want the part to be rested and protected. I stands for applying ice to the part so that bleeding is less and swelling is less.
Okay.
C stands for compressing the part so that again the bleeding is less and swelling is less.
Okay.
E stands for elevation of the parts.
That's a great way to remember a sequence of actions that you need to take before you can get the injured person to a hospital. RICE.
That's right.
RICE. The patient or someone who's just received an injury is at the hospital.
Yes.
What happens?
When patient receives injury, we have to empathize with him. We have to make him understand that first we have to assess the injury and what exactly is the injury, and then as per that we deal with the patient.
Do you know why I asked this question? Because a lot of people, when we, myself included, when we get injured, we try and avoid going all the way to the hospital, and we say to ourselves, it's all right, it's nothing major. If I put a bag of ice
That's
on
right,
the knee, on the shoulder, it'll go away. We're not doing ourselves a favor, are we?
Everybody has to understand there are certain times when you have to decide that you need a doctor. And when you need a doctor, you have to understand if swelling is more than you anticipate by minor trauma.
Mhm.
Swelling is more, pain is more, and your affected function is involved much more than anticipated due to minor trauma. You have to see the doctor. Even benefit of doubt goes in favor of seeing the doctor rather than not seeing the doctor.
That's a great point. So, doctor, when it comes to modern treatments, what are some of the advancements that science and technology has empowered us with?
Recently, we are treating these injuries, especially repeated trauma injuries, by biologics. Biologics is your own body tissues which we modify and deal with the injury.
Mhm.
The most common is like PRP, platelet-rich plasma injections, which we give to the area to accelerate healing.
So, explain this to me. This is fascinating. So, you extract the blood.
That's right.
What do you do with the blood?
We centrifuge it, rotate it,
Okay.
and we extract growth factors out of this blood.
And then you re-inject it back into the area
Which is
where-
affected.
where healing is not as fast as it should be, or
Yeah,
it's
these
slow.
are chronic repetitive injuries which heals in years.
Okay.
So we want to accelerate healing by this method, which is recent and it is very effective.
That's amazing. God bless science. Well, thank you very much for this insightful information, Doctor. If you have any questions for Dr. Vidhani, please leave your comments down below. We'd be happy to answer you. And thank you for watching The Good Doctor on EasyLiving.com, where you can find anything and everything lifestyle.